Okay. Should we go, you move on?
Yes.
Okay.
I feel confident in this part now.
Okay. Right. So let's look at the second part. Okay. So this is your second part. Okay. Now, second part, you are required to choose one key public health issue. So one key public health issue is the key issue you have chosen in your when producing your leaflet. So
Yep.
this is suicide. Yeah, suicide among 21 to 35-year-olds. You haven't specifically talked about the ethnicity. No, it's just general as it is. Okay, so keep it to that. Don't
Yes,
make it
course.
different from
Say
what
the-
yeah. Okay. Otherwise, it's going to be difficult. Okay. So it says that affects individual, family, or population. So here it is affecting the population. You are not focusing on the family. You're focusing on individual. It may
Yes.
obviously all these individuals or families indirectly they are going to be affected anyway. Okay. They are going to be affected in a way. Yeah. Now, explore and discuss the determinants of health issue and analyze any inequalities and policies that impact on the public health issue. Now, this issue. Can you see that?
Yeah.
All right. So, what is this issue?
Issue is the problem that faces the public. It's an issue that's been, yeah, is it that?
I expected that. Okay. I expected that. No, have a focused thinking. Okay. Right. Let's go back.
There's a lot of issue there, yeah.
No. You are required to choose one key public health issue.
So what do they mean about exploring and discussing the detriments of health issue? So the detriments of suicidal rate.
Exactly, but in linking it to inequalities, policies. Okay, so you're going to review these inequalities, these policies, okay, in relation to your suicide.
Right.
Your health issue you have identified there is the suicide. So how does actually suicide, okay, being contributed by inequalities, policies that we have now, okay?
Yeah.
Otherwise, you end up writing totally different thing altogether.
Yeah. So the detriment is related to the cause of suicide.
Yes.
And the inequalities would be the deprivation of not having enough services to prevent suicide. Is that what it is?
No, unless it's specifically in that particular area.
Okay.
Inequalities here might mean things like, for example, okay, some age groups, like say, for example, young people. Okay, what are they struggling with this modern days?
Unemployment.
The unemployment. Okay, why are they?
University.
Why are they struggling with employment?
Because there's lack of job, lack of economical investment in them.
That's not true. There are plenty of jobs. I can show you. There are plenty of jobs. No, what is the problem with them?
They're not lazy.
No, it's not because they are lazy. No. What's the main problem?
A rise in mental health issues?
No. The mental health issues are going to be contributed because they don't have the job.
Yes.
Okay. Yeah. But what's the main problem at the moment?
Not being informed.
Not being
informed.
Yeah. So lack of knowledge might be one of them. Any others? Which is the most important?
Not educated.
Yeah, some of them are educated. I've seen one complaining on television. Yeah. We has got even masters. But he can't find a job.
Yeah.
Mm-hmm.
What is it then, do you think?
Yes, now if you and me, okay, so you graduate, you get your qualification, all right? And you come says, oh, Sophia, look, there's a job here. Let's apply together. Okay.
Yeah.
This job, definitely you do qualify, I do qualify. And then we apply for it. I'm going to be shortlisted for interview. And you are not shortlisted for interview. Why do you think I'm shortlisted and you're not shortlisted?
Because opportunity.
Huh?
Is it opportunity?
No. You try to find the reason why you have not been shortlisted. And I've been shortlisted. We have applied to the same job. We both qualify.
Likability?
And not like ability, no, we don't want to like people.
Educational,
Mhm.
so status, social status. You have
Not
a
the social
PhD.
status. Not necessarily, because the degree they are going to look at is, let's say you have taken masters, I've got masters, so that's fine. They will be assessed at master's level. No, when we go there, okay, you have never worked. That's what they are going to ask you. Have you ever worked before? No. Which means you don't have,
Experience.
yes, you don't have experience, you don't have skills. So if business is going to employ people, they are going to employ based on how quickly can you be able to perform and improve the outcome within the business itself, which means the performance in terms of output, which are maybe products, or in terms of reducing the cost, whatever. Because they are thinking of profitability. If they are going to train you first, it is going to cost them money, it's going to cost them time. It is going to take longer for you to become more productive. Do you follow? So this is the problem with young people. If we go together looking for work, the business is more likely to look for someone who has got skills, someone who has experience, who is more likely to, as soon as it comes into the office, it starts working. Not that I need to rely on somebody else to train me first.
Yes.
Can you see that?
Yes, and that's the inequalities then.
Inequality, yes, because you are treating people also differently. Can you see that? Yeah. Yeah. So young people are much more vulnerable in almost everything. Okay. The same with the older people. Okay. The old age group, even if they want to work, but you will see that obviously their energy is not the same energy as yours. So they're going to be slow. They are slow in everything, processing information. Now, the business will say, look, it will take you 3 hours, something which you would have done in an hour. You see, because now you are paid by hour. If it takes 3 hours, it's going to cost me more, okay, than actually taking someone who is going to work and do the same work in 1 hour. If I want to teach someone or train someone on the computing skills, and I take an old person, it will take longer for me to train him. Okay, it will take quite a number of days, and those number of days are going to cost money to the business.
Yes.
So that's the inequality. Yeah, that's inequality is coming up. We are treated totally differently. Okay.
But so then the policies would be the protective factors, isn't it? Because policies are in place to support individuals to overcome. It's like social inclusion.
You need to be specific what policies are there. So that's what you're trying to do.
Yeah.
Right? Now, there also, you need to be critical. There's a difference of having a policy and implementing it. Okay? There are policies all over. Okay? But obviously, are they implementing them? What's the problem? Why are they not implementing them?
Yes.
Okay? Mm-hmm.
Fair enough. I got it. Implementing. Yep.
Okay, so you are going to look at those policies that are available now in relation to suicide. So, what are the policies, particularly preventive policies, that are available now, and try to look through them whether they are actually being effective or not? Probably policies have been developed, but the organizations are not implementing them.
Yes.
Mm-hmm. Okay, so it says identify and discuss. Okay, the role of yourself.
Yes.
Right. So that role you have already started. So what do you think your first role is? Because you started already your role. What is your role?
To promote public health.
Okay. So now if you promote public health,
to help people have knowledge, support them to be informed, give them the resources that they need, like the talk therapies or workshops to excel in their knowledge or blah blah blah. Yeah.
Right. So let's look at those you talk a little bit about. How they fit in. How they fit in you. Yes, when you were learning in class, yes, you had all those to promote public health. But here, what have you got?
My role would be to raise awareness, to give them insight as a mental health nurse. Yeah.
Who?
The individuals that are that are suicidal, feeling suicidal.
Yeah, you need to focus on the issue. The issue is about the suicide, and then you're also focusing on the 21 to 35-year-old male. Okay.
Right.
So try to move away from generic to more
Right.
specific and focus it.
So identify and discuss the role of the, I can't see it, of the.
Yeah, because I've cut off the other page is on the other side of the nurse.
Okay.
Number one is assessing the public health needs, and number two, promoting the health and well-being of your chosen individual. Can you see family or population? So you are specific. Now this, your public health needs here. This is the group. The group that are aged 21 to 35.
Yes.
Yeah. So what are their health needs? Okay. Obviously, you should have explored them already when you were doing it, your part one. Yeah.
Yes.
Number two, it says promoting the health and well-being of your chosen group, which are chosen. What you have chosen are these mental, not mental. These are suicidal.
Yes.
Suicide individuals aged 21 to 35.
Yes.
Mm-hmm. And that's all what it is. Straightforward.
Do I need to write a reflection in the end?
Now, what are you going to reflect on? That's the question. Let me ask you again.
Well, I can reflect on.
Yeah, what are you going to reflect on? Because you reflect something you have already done. You have done.
True. There's no point then.
Mm-hmm. I can't see anywhere. Did they explain? You need to go to reflect.
No, there's none. There's nothing.
Yeah, because you reflect on what you have done. You can draw conclusion, but not reflecting in this case. No. I know most of your assignments is about reflection.
Yes, it comes automatic now. Even when we don't need reflection, we reflect.
Yeah. Okay.
Okay, I think I got it. Draw. Yeah.
Okay.
Yeah. So what I'm gonna do, I think we were right. I don't know why I wanted to book 2 hours. To be fair, I don't know why.
I looked at it. I saw. So no, it's just nervous for nothing. Yeah.
Yes. Okay. What I'll do is, so now what I've done 3 hours with you so far, didn't I?
Yes.
So what I'm going to do is I'm going to get cracking. I've got one more assignment that I need to break down. Yeah, I've already prepared that one. So if you want, we can do that one Friday evening.
That's fine.
Yeah?
Yeah, send everyone already.
Thank you so much, Dr. Fletcher. I'm becoming a genius.
Remember to put your submission date on the top of assignment if you send me the draft. Okay?
Yeah.
Yeah, because it helps me to see whether I can rearrange with your other assignments that students are sending in. Yeah. So that those which are near come first, and those which are far, they can wait. Okay?
Yes. Thank you so much. Yeah. God bless you. Okay?
No problem. Okay. All right. You take care.
Bye-bye, sir.
Okay. Bye.